This week on Healthy Living, what is cerebral palsy? We'll have more on the lifelong disability and a look at the plight of children with cerebral palsy in Cameroon. Plus, a new oral polio vaccine gives a new boost to the fight against the disease in Africa. Finally, new technologies aim to reduce carbon in the atmosphere. These stories and more in this edition of Healthy Living. Hello, I'm Linor Moudou. Thank you for joining us on Healthy Living. It is a group of disorders that affect a person's movement and coordination. Cerebral palsy is the most common motor disability in childhood, according to the U.S. Centers for Disease Control and Prevention. The condition is caused by irreversible brain lesions occurring before, during, or shortly after birth. There is no cure for cerebral palsy. People who suffer from the lifelong condition develop, among other things, uncontrolled movements, muscle spasm, shaking hands, sometimes seizures and difficulty sleeping. The CDC says population-based study from around the world estimate that about 1 to 4 babies out of 1,000 are born with cerebral palsy. We start in Cameroon, where with neither easy access to education nor acceptance in most families and society, the plight of children with cerebral palsy remains dire. Awareness campaigns are slow to reverse the trend, as we will see in this report by Emmanuel Jules Ntap in Yaoundé.
10-year-old Blondine never knew her father. He left when she was very young, rejecting her because of a condition she has called cerebral palsy. Blondine cannot walk, speak, or sit. Lucy, her mother, lives with her in the family home in Yaoundé.
She was born fine. It was 2 weeks after her birth that she started to show signs of the disease. At the beginning, she had a buildup of fluid in the brain. After that, she had meningitis, then tetanus. We couldn't treat her. When we arrived at the hospital, the doctor had told father that they had to operate, but the operation is delicate. Father was afraid. He refused.
In a ceremony to mark World Cerebral Palsy Day, Lucy joined other parents who have similar cases and the same challenges, including access to education.
We really need the attention of the state authorities to be able to take charge of them and to be able to even create schools with accommodations for people with this disability. No human being can develop while remaining within 4 walls. We must go out and meet others and be able to be accepted and enjoy the full rights that society offers us.
But there are social barriers preventing their inclusion.
Majority of the people consider cerebral palsy as superstitious disease. Therefore, cerebral disabled children are considered as mysterious children like little witches, ghosts, or snake children, or evil spirits who have reincarnated to impoverish the family.
According to experts, there are a number of reasons someone may have cerebral palsy.
Des accouchements à risque qui se déroulent dans des formations sanitaires.
Risky deliveries that take place in health facilities that do not have the competence to take serious cases. There are infections that start from mother to baby, malformative causes, toxic causes, like when the mother consumes toxic products or drugs, and the situations which cause a severe lack of oxygen to the brain.
Since its creation in 2017, the Association for Support of Children with Cerebral Palsy has more than 100 members and supporters.
Now an expert tells us more about cerebral palsy. Take a look.
It's a condition which occurs as a result of an insult to the brain. And this insult usually can occur when the baby is still in the mother's womb. If there's any insult which has occurred to the mother, which has caused either to reduce the blood supply to the baby or reduce the oxygen supply to the baby. The second most common cause that we see is the what we call neonatal jaundice, which basically means the baby turns yellow a few days after delivery. And the third most common cause are infections, which occurs after delivery. And the common infections that leads to cerebral palsy are meningitis, which basically are infections caused by either bacteria or viruses into the brain. There's still a lot that we can do in terms of improving the quality of life of children and families with cerebral palsy. And this comes with managing or treating other, what we call them comorbid conditions. Number one is the epilepsy, which affects about 40 to 50% of patients with cerebral palsy. There are medications which are available and we can actually treat the epilepsy. Number two is problems that usually impair vision and hearing. With the squint and refractory errors and double vision, that can be managed with the kind of facilities that we have. But unfortunately, when the child has completely lost vision, there's no treatment which is available currently. With the hearing, we can use hearing aids, the main stumbling block being the cost. The third aspect, which is also quite common, is the feeding. With feeding also comes inability to coordinate the swallowing, which oftentimes leads to aspiration and recurrent infections to the chest. We do have medications available for treatment of chest infections, and these usually are completely cured. Most families who unfortunately have a child with cerebral palsy, there's stigma within the family, and then there's stigma from outside the family. People will think probably this family is cursed. It's a system's fault, which had failed to identify a problem early and to be able to intervene appropriately early so that we can prevent. If our health system is working properly, we should be able to identify all the mothers who are at risk, and that can be prevented. So that is at the health education and health awareness level. The health system itself, which should be able to make diagnosis early by improving the medical education to healthcare workers, that what are the early symptoms or what are the early signs which signifies that these children are at risk of developing cerebral palsy, so that these children can be able to be identified early and intervention early and improve the quality of life of these children.
October 24th was World Polio Day. 2 years ago, the world celebrated significant progress in ending polio, as 2 of the 3 wild poliovirus strains had been eradicated. But observers say COVID-19 has hindered the gain made. According to data from UNICEF, about 23 million children missed out on their routine vaccinations in 2020, an increase of 3.7 million compared to 2019. Meanwhile, WHO says more than 80 million children have been vaccinated with the novel oral polio vaccine type 2, NOPV2, in 6 countries in Africa. The WHO approved it for emergency use in November 2020. Nigeria was the first country in the world to use NOPV2 to tackle an outbreak in March of this year, vaccinating 7 million children in 6 states. Other countries have followed suit, including Benin, Congo, Liberia, Niger, and Sierra Leone. Africa was certified free of wild polio in August 2020, but outbreaks of circulating vaccine-derived polio type 2 are still being reported. Feeling bloated? Too much gas? We've all felt it before. Abdominal bloating is when the abdomen feels full and tight. We asked an expert some common causes of bloating and how to get relief. Take a look.
Bloating can be defined as a sensation of when there's excess gas in the gastrointestinal tract, and people can complain of flatulence and farting and burping, and it can also be a symptom of constipation. Now, you can avoid bloating naturally by making sure you eat a healthy diet and then drinking lots of water, identifying and avoiding foods that can trigger bloating. such as fried fatty foods, avoiding carbonated beverages and sodas, and avoiding taking excess of air in when you are chewing gum or drinking from straws, avoiding alcohol. It's also important that there's a place for colonoscopy, especially when you have these symptoms of bloating and constipation that have gone on for such a long time, maybe more than 3 to 6 months.
Female circumcision, known as female genital mutilation, is illegal in Kenya, but is still being forced on young girls in some areas. Cases increased after schools closed due to the pandemic, but one survivor is fighting the practice in an ethnic Somali community. Brenda Mulinya reports from Garissa, Kenya.
23-year-old Yasmin Mohammed volunteers with Silver Lining Kenya, an organization that champions the rights of young girls and women in Kenya's Garissa County. She is focused on eradicating the illegal and harmful practice of female genital mutilation.
As someone who has gone through the act, I know how harmful this is.
The number of FGM cases jumped after the coronavirus pandemic forced schools to close, particularly in Somali communities in Garissa.
During COVID, it was a moment of staying together. So that is when parents will realize, oh, these children are growing. So for the ones who are young, there is need for them to go through the cut.
The practice of FGM remains illegal in Kenya, with the government pledging to eradicate it by the end of 2022, 8 years ahead of the global deadline of 2030.
The Somali culturals, they believe if a girl doesn't go through the cut, she is like someone who is not clean.
The Kenyan government's anti-FGM board is leading the campaign against the harmful practice.
The only big challenge we have is that girls are getting cut at a younger age when they don't understand what has happened to them. So the communities are really coming up with other new ways of evading the law.
Kenya officials say there are hopeful efforts by the government, and advocates for the girls will keep the country on track to bring the practice to an end.
A bunch of new technologies are popping up that could help bring global energy-related carbon dioxide emissions to net zero by 2050, and all need investment. Governments worldwide are having to decide which one suits their geography and how much they can spend on a given technology. More with VOA's Mariama Diallo.
In September, some energy companies that have been trying to rid the atmosphere of carbon celebrated some big milestones. In Iceland, 2 companies launched one of the largest direct air carbon capture and storage plants.
With a capacity of 4,000 tons of CO2 that are captured from the air every year. So that's the nominal capacity. And we are then handing over this CO2 to our partners from Carbfix, who inject it underground, and the CO2 there is mineralized with the basalt rock, so it's turned into stone, literally.
Fusion, like direct air carbon capture, is another potential new development in alternative energy. Fusion is a carbon-free energy source based on the same principles that power the Earth's sun. In France, a giant fusion experiment involving the largest magnet so far arrived at the International Thermonuclear Experimental Reactor, or ITER, an international nuclear fusion research and engineering mega project.
ITER is expected to cost 20 billion euros, give or take, for construction. Right now, Europe is importing 1 billion euros of petroleum every day.
But challenges remain when it comes to storing energy in the long term.
You can't have batteries at the moment that are economic enough or big enough to store all of the electricity needs that a country will require over the winter months, for example. And there we look to things like long duration energy storage. We already have that in terms of pumped hydropower, but then we have a raft of other technologies which are either existent or being developed.
The 2021 United Nations Climate Change Conference, or COP26, will take place in November in Glasgow, Scotland.
For the latest news and coverage on the coronavirus, stay connected to Voice of America at voanews.com. You can follow me on Twitter at Linoch Moudou. That's our show for today. Until next time, stay well and strive to make every day a healthy day.